Hello and welcome to It's Your Case, brought to you by VetCT.com. I'm Lucy Meehan and I'm your radiologist on demand for this case. Today's example is a 19-year-old Warmblood gelding who's been eating slowly and is reluctant to pull the hay from the haynet. Once you've reviewed your radiographs using your systematic approach, then you're ready to watch this video. So I'm going to highlight the most important findings for the teeth in this case, and we'll talk a little bit about nomenclature and naming of the teeth as we're going along. So first of all, the views that we have, we've got intraoral views of the upper or maxillary incisors and an intraoral view of the lower or mandibular incisors. These views are required with the plate in the mouth, so we put the x-ray plate in the mouth of the horse, usually with some protective covering on it, and the upper incisor view is acquired with the machine dorsal, so the x-ray beam coming from dorsal to ventral into the mouth, and then the mandibular view is acquired from ventral to dorsal. If we look at the upper arcade first of all, I'm going to talk a little bit about nomenclature, how you name the teeth. So I'm going to draw a line between left and right, so you can see right is to the left of my screen and left is to the right of my screen. In the Tritian numbering system, which is what we commonly use in radiology, the teeth are numbered by arcade and then by tooth. So the first arcade is the right upper arcade, the second arcade is the left upper arcade, and then the third arcade is the left lower arcade, and the fourth arcade being the right lower arcade. So if you're touching your own face whilst you're doing that, it's like you're drawing a C on your own face. So this is the first arcade here, and the first incisor is tooth 1, tooth 2, tooth 3. So this is 101, 102, 103. And then similarly, this is a second arcade, so we've got 201, 202, 203. And then if we do the same with the lower teeth, we draw a line here. So this is 301, 302, 303, and 401, 402, 403. So that's just worth knowing and worth remembering, because oftentimes with radiology reports we will use that as the way to identify the tooth. So if we look at our incisor teeth and we look at the upper arcade, we can see that we've got quite blunt roots and we've got a very, very lucent space. We've got a broad lucent space around all of our teeth here. You can see the normal root of the 203 tooth here, but you can also see that it's surrounded by abnormal material, so amorphous, calcified or mineral opacity material, and you've got quite a lot of widened periopical space here, and you can follow this through. You can see this with all of the teeth, and to a greater or lesser extent you can see the more normal part of the root as well. We've got some sclerosis just in here as well, particularly around the 103, so just around this tooth here we've got a reasonable amount of sclerosis. So that's fairly conclusive for the upper teeth, and it's quite a marked manifestation of this pathology. If we look at the lower arcade, we have got, our incisors have got a much more normal tapering root. So this is a more normal appearance for the incisors, but we've still got these amorphous areas of mineral opacity surrounding the roots and a slightly increased periodontal space, more than I would expect to see, and certainly you can see this associated with all the teeth. So although the lower teeth aren't normal, they are less severely affected. So this horse has a condition called equine osteoclastic tooth resorption and hypercementosis. I always have to think slightly about how I'm saying that because I sometimes get the letters in the wrong order. And this is a well-documented condition in older horses. It can lead to a reasonable amount of pain, so horses are often reluctant to graze or reluctant to pull hay from the haynet, reluctant to do anything that puts pressure on those teeth. So it is relatively frequently seen. And it's unusual for, well, it's not unusual for it to affect upper and lower arcades. It's interesting that the lower arcades in this case are less severely affected. There are a couple of references on the report for you, both of those from Equine Veterinary Journal. This is a relatively recently discovered condition or recently documented condition, so it's not very well documented in the literature, but there's a couple of quite nice papers on the report for you. So in summary, this horse has equine odontoclastic tooth resorption and hypercementosis. So what we're seeing Here is the hypercementosis, so this amorphous mineral material, and the reason that we can't see the roots very clearly is because of the tooth resorption. I hope that that is clear. If anybody has any questions, do remember it is your case, so please put any questions that you have on the social media platform. Thank you.